Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter, total.
Nowadays, we have seen the many number of cats in the clinics, almost 30% of the cats among the small animal population. Among the cat diseases, we have seen the most common disease when you come for the dermatology, that is parasites and the mange infestation. Parasites means including both mange and ticks and flies also and fleas also. Before going for my topic, first I have to say thanks to my mentor, Madam Nalli Kumari Garu, former university head and professor, and former associate dean and director of extension. Because when I did my PG in veterinary dermatology, she was guided me and mentored me in many aspects. And those days we have identified the Demodex conway, which is the first identification in 2010 in dogs. Thank you, madam. It's coming to the topic. When we are going to consider as the external parasites in cats, we have many in number. That's I'm starting from the ticks, flies, and lice infestation, and mite infestation, and fleas. In all these cases, we are going to see typical dermatological lesions. When we need to go for suspicion of parasites, sometimes we are going to see similar clinical signs not only in parasitic disease but also in some other conditions, which including cervicofacial pruritic dermatitis, especially in cats, self-induced alopecia because of the continuous nature, psychogenic licking nature of the cats. Next one is miliary dermatitis, where we are going to see most commonly at the bridge of the nose or the forehead region, and eosinophilic lesions might be a granuloma type or infiltration of the eosinophils. Because these are the common diseases where we need to go for differential diagnosis with the parasitic infection. Now I'm going to give a small brief about the what are the external parasites. Later we will go for the how we have to identify that. Ticks, you know very well, a tick infestation, but must only concern here in cats. Generally, like in dogs, we can see visualize the ticks. But in cats, it is a difficulty to identify the ticks over the body. The reason it have the highly self-grooming nature. Second one is the flea infestation, where we are going to see they are not completely present on the cat's body. They are going to come and have it their meal, and they will go and they are going to produce the flea eggs. These eggs are going to become as a larva and pupa and become as an adult. These are all the things we are going to see not only on the host, they can see outside the host also. For that reason, it's very difficulty to identify the fleas in the body. Next one is the flies. Here also, when there is a possibility of presence of the small erythematous lesions or pustules, they are going to rupture and there is attraction for the more flies. These flies are going to invade and development of the some magnetic stage is the most common. When is the secondary. Next one is the first to bite hypersensitivity, where we are going to see normal mosquito also can cause development of the skin lesions, where the active parts will be there in the body, where less hair will be there. Most commonly, we are going to see as the nose bridge region, otherwise the pass region. This is the most common differential diagnosis for the miliary dermatitis in cats. Next one is nototrismate. Now we are going to discuss about the general phenomena, how the mites will be there. The general life cycle, the adults will be there. They are going to produce the eggs, and next stages will be there in skin scrapings. For the specificity of the nototrichate, this is the most common itchy mite in cats. Whenever any cat comes to the clinic, it has severe itching. First, we need to suspect for the nototrichate. Next one is otodactylus cyanotis. This is the mite where you are going to see presence of the ear canal, because the cats with this otodactylus are going to produce the wax-like content will be brown in color. Generally, in other cases, there are zero substance fluid will be there, but in these cases, we are going to see wax will be brown color. Any cat with producing the browny wax contents from the ears, we have to suspect for the otodactylus. The identification we will discuss while going for this is just for information. We can call this mite as ear mite. One more logic is there here. All the cases, otodactic mites may not be present in the ear. The reason here, when you are going to see that area in the scratching, the paws will get the mites, and there is a possibility when the nature of the cat is the tail is going to circumvent over the head region. Automatically, they are going to present at the base of the tail region. So whenever I are checking for the mites, not only ear wax, we need to go for examination of the dorsal part of the base of the tail also we need to check. Next one is the Linarix. We can also call it as a fur mite. Where is it most common? The places where one cat is there from the house, most of the cats will have highly contagious nature will be there. So difficulty to get any scrapings. The reason behind this is very superficial. If you take the hair flex, we can see all the hair also. Like walking, you can visualize if you have the magnifying lens. This is the fur mite, you can call it. Next one is Demodex catae and got two are there, Demodecosis. Here we are going to see the lesions over the periorbital spaces and the nose region and truncal space. Here two will be there, catae, and next one is gotae, where one is highly infectious. Any cat is infected, almost the nearby filaments also can cause. The only difference is based on the morphology, we are going to differentiate these two types of Demodex. This is gotae. They are highly contaminant. Here signs also. For example, you see the first peak is going to giving the information of the miliary. Second one is only it's looking like only alopecia. But even though it had the mites, because they are in superficial nature, they are going to change the shaft nature, shaft consistency. Last one you can see looking like a bilateral, and we can suspect the hormonal imbalance, even though this is a parasitic infection. Next one is cheltellosis, where we can call it a walking dandruff. Here we can see the lesions, how they are going to appear here. The only flakes will be that these flakes are going to present all over the body, especially dorsal region. When these are going to move, looking like these capes are going to appears like that. So you can call this one, this dandruff is moving as a moving dandruff. Next one is trabeculosis, another with the chigar mite. Generally, till now, what we have seen, all the mites are adult mites. They have the habit of taking their own meal from the body. But coming to the trabeculosis chigas, the larval stages will come and invade. Generally, adults won't be there. These have the capability of invading and production of the lesions over the surface of the area. For that region, here we are going to see the first one is erythematous lesion. Generally, previous what we discussed till now, all the mites, they don't have that capability to produce the erythematous lesion. Next one is lice infestation. Here also we can see highly host specific, because for example, if cat is there, only that animal have that capability of the infection to another cat. It cannot infect the other dogs or humans. Highly host specific. They are going to take the debris from the hairs. They won't interfere much. But based on the type, biting and chewing type, they can cause highly irritation to the skin and they can cause development of the secondary lesions. What are the other diseases we have to suspect when we are discussing about the parasitic infections? That is a folliculitis, inflammation of the follicle area, especially we are going to see hairless parts, followed by pyoderma, nothing but bacterial infection. Next one is dermatophytosis, the fungal infection. Next one is atopy, where we are going to see the allergic reaction to the environment or the food. Next one is pemphigus, immunological disorders. With all the diseases also, there is a possibility of development of clinical signs which are mimicking to the mange infection or external parasitic infection. Because we are discussing about the external parasite, we should know the other disease where we are going to see the similar clinical signs. Diagnosis. Before going for the diagnosis of different external parasites, we should know the what are the procedures we should formulate or steps to identify this one diagnostic component. First one is physical examination. If you have go for thorough physical examination, you can identify the most of the external parasites which are visible with eyes. Here what you are doing, you are using the magnifying lens for visualization. Next one is we need to collect the information from the owner, because most of the time owners is going to give the information presence of the pruritus or alopecia, presence of primary or secondary lesions based on the clinical exhibitions. Even though we are collecting the information from the owner, we should know about the grooming nature. Because when we are discussing about the compulsive grooming in cats, this is very essential. There is a when there is a frequency of licking, chewing of its own hair, leads to development of some clinical signs which are mimicking the parasitic infection. Why you are getting these complications? When there is a parasitic infection, they can cause severe irritation, causing secondary infections and thinning of the hair, which is almost making the psychological alopecia in cats. For that reason, we need to, before going for collecting the sample, we should know about the abnormality in the self-grooming pattern of the cats. Next one is, next we need to go for physical examination. We have to identify the possibility of the presence of the ticks or fleas. Should know that where the most probable places will be there in ticks. One is around the eyelids and within the ears, because these are the places difficulty for the cats to remove their external parasites. For that reason, we need to check these areas under the collar area, in between the forelimbs, between the toes, and around the tail region. In case of the fleas, most of the time they will come and go. They won't be there continuously over the body. For that reason, we need to check the ear also, behind the ear pinna and dorsal area. These two areas where we have to check for the most flea infestation. This is the tick what you collected from the cat. Ticks easily you can identify and grab it, and with the naked eye also you can confirm it. But further confirmation, we need to have under examination to 4x, the microscope. Next one is flea allergic dermatitis or fleas, where we are going to see the almost mimicking the clinical signs of miliary dermatitis. The specific location, we need to check for the lesions at the around the ears or base, neck region, followed by dorsum region. Some other clinical signs also will be there, but most commonly while examining you have to check for these areas. Reason behind, they won't be there permanently over the body. Simultaneously, when we are checking for the fleas, always there is a possibility of presence of some cystodes in the fecal sample. For that reason, we have to check for the fecal sample too. But the confirmation for flea infestation while clinical examination, you have seen the animal, you didn't find any fleas. Next, what to do? We need to check for the flea data. Here, how it's going to formulate here. When they lay the eggs, they are going to convert into the stages. They are going to appear this one over the not only animal's body, they are going to visualize over the dust, the house, or the furniture area, some dust material. Still, if you want to check, we'll examine with that. Next one is lice infestation. Here also cat looking like normal, but you can see the hair, the pattern of this cat. And see, I collected some of the material. You can see this video. Initially, the owner thought, and previous people also, they thought these are the ticks. But actually, these are lice. We are collected from the all over the body, lice were there. Two types will be there based on the type of mouth parts, chewing or biting. This is the lice. These are host specific, but they can cause irritation to the human handlers, the pet owners, because of their class nature. They won't feed live blood also, but they have the chewing capability. That's causing irritation and development of the erythematous lesions. Next one is rotatorus mange. When cats come to the clinic, by showing the signs of ear marginal dermatitis, when you are going to see ear margin erythematous lesions or crusty lesions, we need to suspect for rotatorus. Simultaneously, it have the severe pruritus as the main sign. That's why you can itchy mite, you can say that word. This is the morphology of the mites. The first showing to the 4x magnification. You can see 1, 2, 3, 4, 5 mites here, including that. This is a 40x identification. This is the dorsum space where we are going to the circular patches of the raised borders with the spines. The next one, you are going to the ventral surface of the mite where you are going to see the all the 4 pairs, and they are going to see within the circumstantial area. We are not going for which are going to go for differentiation with the Soraptis. Generally, we won't get the cases in Soraptis, but when we go for the differentiation, we need to know about the morphology. So, notidress, adult mite, we took the scrapings, examined under the only 10x, 4 pairs, round in nature, and all the legs are within the limits of the border. Next is the ododectis. Here we collected the swab from the ear, that is the vaccine material. We are going to see here different stages. Eggs are there. Eggs are within the different stage. You are going to see here circumvention material within the borders. These are the adult mites where you are going to see male and female will be together like this. This is the differentiation how we can make this previous nototrius and notodectis. They based on the morphology. This is the hind leg. The last components of the legs will be extended then compared with the notodress. This is the morphological difference. Notodress cases we are going to say around in nature always. This is sometimes literally will be there. We can call that is as a ear mite. Next one is fur mite. You can see the hair, the pic. When you first I saw this case as alopecia and I have seen the hair also very thin and the cortex abnormalities are there is there medulla region also. But when you went for examination of the skin scrapings and collected this hair, you have seen the abnormalities of the brains of the mite. You see the second slide here, that salt pepper appearance we used to teach in theory classes, how it will be. You just see the second one. It didn't show the much alopecia, but severe itching was there. But we went and examined this hair pattern here. You have seen the presence of this salt and pepper mixing powder sprinkled like over the body. In these cases, you collect the hair and examine, you are going to see this mite. The same mite. This is also on 10x itself. A similar fashion will be there, but if we compare to previous mites what we discussed, they are a round in shape. Second one is little vertically will be there. The hind limbs are going to extend it. This is a slender one. There is a difference to. Next one is the demodicosis. Here also you can see the lesions around the eye and nasal area, muzzle area. You can see all the 4 stages of the demodex here. Egg stages, full larva. Next one is adult mite. Here are different stages can be possible. Always we need sometimes it's difficulty to get the adult itself. For that case, eggs are sufficient to identify it. Scratch is there. This one live mite. After collection from the hair fleck itself, we have noticed this mite, the short form. We can call it in cats. Generally, we used to say we need a deep scrapings when we suspect demodicosis, but demodicosis cornea in case of dogs, in case of gout, in case of cats. So surface spot is sufficient, or simple hair pluck is sufficient to identify the Demodex. Next one is, this is the video showing the most of the time we are going to use the pinnapetal reflex is a confirmation or giving the chance for diagnosis in case of dogs when sarcoptic mange will be there, or some percentage of the cases with atopy also they are going to exhibit allergy also. But in we tried, but a few cases we cannot say confirmation. With this we can diagnose the type of mite here. Like same physiology what we are going to describe for scabies in dogs, here also when you are providing the itching to the ear endings or ear margins, there is a possibility of development of the abnormalities of the hind limbs, same scratching behavior like in dogs. With this we can identify cat suffering with the mange, but we cannot differentiate the type of mange mite what it had, because I have seen different mite infestation, the same sign. We cannot differentiate what type of mite. But what is the need to know about the differentiation of the mite? We will discuss in the treatment place. Next one is still now what we discussed, what we have seen, where all the cases are related to the mite infestation. But cases with mite infestation, if you won't treat earlier, early stage or early diagnosis or development of the initial signs, there is a possibility of development of the secondary bacterial infections also. Those cases, the most common is bacterial infection. How they are going to see the clinical signs here. It may be wet or complete pyoderma or deep pyoderma, or sometimes it's going to ended with only folliculitis. It will be only based on, but there is a possibility when there is a development of secondary lesions, severe itching will come. It leads to the scratching and development of the secondary lesions. Next one is associated other disorders, otitis, because most of the time that otoductic mites are going to play in the ear, yeah, ear canal. They can cause obstruction, or they can travel and development of the otitis externa, sometimes media also. When they are going to black it, or they are going to interfere with the balance, we are going to see some other clinical sign, that is the vestibular signs. The third one is going to show the abnormalities of the face, tilting of the head one side. This is the other some association condition. Sometimes we may miss about the mite infestation can cause, but it's also happened. Now see the video here. Some scratches are there, some lines. Dr. Sinha, can you edit that yellow line?
Hello, doctor.
Can you remove that yellow line is there? Oh, the screen, some yellow line is there. Someone written. It is there. Okay. You know, see the cat here. They are developing the vestibular sign here. When you are going to discussing about the in cats to vestibular sign, central and peripheral, there is a possibility of the presence of the lesion aside of ear infection, or based on the imbalance side where it's completely closed or blacked. In this case, we have noticed the initially vestibular. Later, we collected the sample and seen after treatment it took the normal. Next one is some other associated disease conditions also can be possible when there is a presence of external parasites, including hemoprotozoan diseases, Cytoxin felis, hemobotanylosis, where we are going to see development of the neurological signs and pale gums and icteric mucous membranes. When you are going to see these three signs along with some external parasites, you have to suspect there is a secondary infections. Next one is cystodes. When there is a flea infestation will be there, there is a possibility of the presence of the cystodes. For that, we need to collect the fecal sample and examine this one. The eggs will be there, pockets, Or sometimes directly you can see those segments which are motile can directly come from the coloration. Otherwise, you can check for these segments over the bed or the floor region. When there is a cysts are there, these segments are there. We need to suspect that there is a recurrent flea infestation to the cat. Next one is till now have seen the what are the diseases, how they are going to exhibit. Now we are going for confirmation, how we will diagnose it. Here we are going for the skin scrapings. Always you have to remember collection of the skin scraping should be towards the way how the hair will be there. Before collection of the scrapings, we need to add the little drop of oil or glycerin material which is available as a soothing. You have to collect the two types will be there. One is superficial scrapings, next one is deep scrapings. Immediately after collection of the scrapings, we need to examine under a microscope for external parasites. What we can see immediately, lice infestation, demodicosis, and notodress. When you need to go for examination of the further diseases, we need to add 10% potassium hydroxide or dimethyl sulfoxide material. When you are going to add these two types of material to the skin scrapings, within 20 minutes, we are going to see little bit digestion of the keratin material. It's nothing but the skin scrapings that the hair is going to digest. In those cases, also there is possibility of notodress. No need for boiling. Severe infection is that you can see eggs here followed by adult mite. Here we can see the fungal hyphae as a secondary. Here also we can see the fungal hyphae. Spores and hyphae are going to visible, but it take minimum 20 minutes time to soak in potassium hydroxide 10% solution or dimethyl sulfide, because dimethyl sulfide is better than compared with KFH for digestion process. Next one is examination of the hairs, nothing but the trichogram. Here we need to go for examination of the hairs. For that, we need to correct the peripheral lesions from the where you have noticed the lesion. Complete hair we need to take. Most of the time we are missing the follicle or tip. We need to have the tip and the shaft and the follicle. Here, always you have to remember a most common mistake. We need to lower the microscope condenser when you are examining for the trichogram. Previous cases, no need. We need a sharp or bright light, but this we need to have the lower intensity of the light. What is the utility here? We are going to see the different stages when examining the hair bulb. Anagen stage and telogen stage. Anagen we can see here pigmented and round one looking like some club. Telogen is going to exhibit the other pointed one and there is no pigments will be there. It's going to give the stage growth, hair growth is there or not. Most commonly, this information is going to useful for us to know about the other diseases, especially hypothyroidism, hypothyroidism. We are going to rule out with this. Next one is examination of the hair shaft. If you examine the hair shaft, needs are going to attach to the hair shaft. You can visualize. If what else may not be there also. Next one, hair shaft. Moving of this demodex over the shaft region. Next one is a shaft you need to examine for the presence of the exotic and endotrix. Here how they are exo and endo. Next, we need to go for examination of the tip. Hair tip you need to examine. This gives the information about the secondary trauma, the pruritic sign. Next one is acetate tape test. How it can be useful for us. When you have seen the lesions over the body, dorsum or the ear pinna region, directly you can collect tape and apply over it and attach to the slide. You can visualize the mites, lice, and this one also lice. Directly, because you can see without addition of anything, you can visualize directly. That's why tape acetate is very essential. Next one is if you collect this tape and put a drop of methylene blue, keep over it and wait for 2 minutes. Now directly you can visualize these two pictures. Here also we can see these fungal spores. Hyphae will be there. Here also a segmented hyphae. Next one is slide impression test. Previously, what you have seen is a tape impression smears where we can collect it from the dry lesions. When you have noticed the wet lesions, we need to collect the slide impressions. Most commonly, wet lesions, bioderma is there. You have to touch the slide, take the slide and touch the lesions. Now go for staining technique. Most commonly, you are using methylene blue, where you are going to see presence of the bacteria or engulfed bacteria by the neutrophil or Malassezia organisms. Next one is the otic swabs. Collection of the otic swab is very essential. The only caution here, we need to collect the always brown color content, then compared with the clear content. Directly, if you take these otic swabs and examine under a microscope, we can visualize the mites. If you won't find it, next you just fix it with a little flame, light flame for 2 minutes. Next, you can go for the staining technique. We can see these two slides. One is the presence of the malassezia or neutrophils or segmented or any other cells also. Sometimes there is a possibility of the tumor also. When the rupture are going to set the shells. Next one, finally, aspiration. Generally, we are not advising unless there is a elevated lesions, nodular like lesions. Generally, parasitic infection they won't cause, but there is a combination of infections are there. We need to go for needle aspiration. Biopsy. This is also not routine test for the external parasites, but we are advising to identify the concurrent diseases. Next one is the flea combing. Dr. Sinha, can you remove these yellow lines?
Actually, doctor, you can remove that one. I can remove from my side. That's why.
Okay.
There is a pen icon in the screen on the right or left one. There is a eraser option in that.
Annotations is there.
A pen, green color pen icon will be there on the screen. Can you see, doctor? I try to remove it, but I can't. I can do it from my side. That's
See, now
I have
someone else's.
some red.
yes, sir. I have seen, sir. Now. Thank you, doctor. I got it.
Okay. Okay, go ahead, doctor.
Yes, sir. Now going for the flea combing. Already we discussed previously flea combing. When generally we won't find the adult fleas over the body. For that reason, we need to go for examination for the flea dirt. Here, what we have to do, we have to take the white color paper, which needs to be wet, and keep the near to the cat dorsum area. We need to do the combing and collect the dirt material over the paper. When you are going to see directly fleas are there, we can visualize here. When you are going to see flea dirt here, we need to keep this dirt material over the wet paper. And later we are going to wait for 10 seconds or 20 seconds. We are going to see this black color is going to become as a red color around this black spots. Indication of this is the blood, which is voided by the fleas. This is the confirmation of the fleas infection in cats. Next one is the fecal test. Why we need to go for fecal test for identification of parasitic infection, especially external parasites. Generally, because of the self-grooming nature of the cats, when they have the mites also, there is a possibility of ingestion. They will go in and they will be voided. For the confirmation, or when you are failed to identify the mites the skin lesions, this is another option, not to confirm it. This is another option to identify the mites. Here I have to collect the fecal sample, go for the Shita solution addition, but we need to go for flotation, not for the sedimentation method. So it will be float. We have to collect the stop layer for confirmation. Blood work. Generally, we won't advise for parasitic infection, but there is a possibility of some other concurrent disease, especially when you are suspecting for the demodicosis. Because when immunity is low, we are going to get this combination. For that, we are assessing some hormonal disturbance. Next one, the wound swab examination. We are taking and directly light apple green color fluorescence will be there. It gives about the fungal infection. Confirmation, we need to go for cultural methods. Datum dermatophyte culture. Next one is the ABST, otherwise AFST. That's antibiotic sensitivity or the antifungal sensitivity test to treat the secondary bacterial or secondary fungal infections. Next one is the last one is the food trial for identification. When you fail the pruritus, not only because of a parasitic infection, if you want to rule out, we need to add this test. Other some serological and molecular tests are there to identify the specific antibody or antigen. Generally, we are not advising this. Next, coming to the treatment component, what are the treatment can be applicable? Most common treatment, what we have is ivermectin. What we are going to give ivermectin routine cases, that the 200 to 400 microgram per kg body weight orally, or subcutaneous injections we are going to. The only problem here, when you are giving the higher dose, or the age-related activities, we are going to see some neurological signs as a side effects. For that reason, many times we are not advising, but based on the demand only, we are using the ivermectin. But what are the side effects will be there? Stumbling will be there, pain will be there, delicate pupils will be there, severe salation will come, depressing also will be there. But to treat it, we have the few options how to treat ivermectin toxicity cases. Next one is another option for this doramectin, same group of drug. Here we can give this injection as a subcutaneous route. Next one is another oral drug, that's a milbemycin oxime, 2 mg per kg body weight. Nowadays we are getting this drug also. This is also like similar side effects will be there. The only thing always you should be cautionly used based on the type of parasitic infection. Available drugs these two, and this is not available in India as per my knowledge. This is available as a oral anti-parasitic drugs in foreign countries. Next one is when we have the caution, I have the fear of using the oral drugs. You can choose the sprays. Most common spray what we are using is fipronil 0.25. Many companies are available. The only caution here, after spray many times the owners are cleaning it. Actually, we need to spray, need to go for dry it and wait for without washing. Left it, we are going to see that dead fleas are going to fall down. And formite also we are using. Next one is then compare with the previous drugs what we have seen, this oral drugs and spray. Spray, there is a possibility of if you spray excessively or around the face region, there is a possibility of leaking because they have self-grooming nature. We need to go for the spot-on preparations are available. Here, why you need to choose the spot-ons? The owner-friendly because they can give themselves without any inhibitions. Absorption is good. When you remove the hairs, you can have that capability. Prolonged action will be there and less side effects. But why I use the word less side effects? Always when you use it excessively at the same spot, will have the localized allergic reaction. It's common. So what are the products available in the market? Many products are there. Main intention of the products will be silamectin drops. This is the first treatment what I used in my personal silamectin 6% solution. It will give the best results. Followed by combination of the fipronil and methoprenil. Because when we are using this combination, adults can be killed simultaneously. That larval stage also going to treat with this combination. That's why it is so better than compared with using the fipronil alone. Next one is now some companies they brought the fluoronolol not only for topical solutions also available. They can use it for cats. Next one is combination of this fluoronolol along with the moxidectin solution. Always this combination is going to give the complete cure. Complete cure. Next one is some of the colors are available. When you are going to apply around the neck region belt type material, they are also providing this some combination of the medication. One is the imidacloprid in combination with the flumethrin. Next one is propaxar with the flumethrin combination. Next one is a combination of tetrachlorovinas. What is that? Why is the difference between these three components? As I told previously, when we are using the combination of the medications, they will have effect to the different stages of the mites. For that reason, we need to choose it. Number one. Number two, when you are choosing these type of components where they are going to present at the neck region, they have the percentage varies from companies to companies where they are going to release their medicine slowly. For that reason, based on the concentration of the product available, they are advising once in 3 months to change it, or once in 6 months, or once in a year. Based on the availability and the concentration and the releasing capability, we need to change the products. Next one is lime sulfate. Generally, we are advising for management of fungal infection when we have the severe infection. The only thing when you are going to give this lime sulfate, there is a possibility of gastrointestinal irritation. That's the only sign. Next, another how to use this one. The commercial products are available. The only one cost 1:15 dilution in water. Here we need to take the almost 30 ml of the product which they are going to give is in the 1 liter of water. We have to mix it, and the head face should not be brown. It should be dried and wait out. Next one is some shampoos are also available, but compared with the dogs, many very limited shampoos are available for treating the external parasites. That is the Propaxar. sprays or solution contain the chlorhexidine only available as the best safest. But many herbal products are available for treating the cats, not only cats and the below 2 months age group dogs and cats, because where we are going to see the toxicity is more. Next, coming to some powders are there. They are also coming as Profexor and several medication and pyrethrin. When we are going to discuss about the pyrethrin, always you should be cautious. Pyrethrin medications always not advisable, but some companies are going to prepare that 0.15% or 0.015%. Two preparations are there. When you are using very low concentration, it is highly effective. When you are exceeding, or there is a possibility of zone leaking, there is a toxic. That's why pyrethrin components are generally not advising by the safety precaution in cats. Next one is when you are getting this mite infestation, always there is a possibility of ear infections too. To avoid, we are going to choose some products which will contain the salicylic acid, chlorhexidine, and tricidTA, lactic acid, and propylene glycol, and phenoxyethanol. The products which will contain this one, anyone you can choose. Now, only caution here, we need to check otitis is there, is externa or media or interna. Main important, you need to check for the eardrum. If eardrum is intact, it's okay. Otherwise, we need to have we have to choose the proper ear cleaner based on that one. Here I'm going to attach some of the cleaners available from the private limited, where we are going to see the acetic acid, boric acid, and hydrochloric acid and ketoconazole. This is a combination when we are going to see not only this acidic environment, antifungal infection also, tricidity and acetylcysteine for regular sterile solution for the regular maintenance. Sometimes whenever a parasitic infection is there, not only we have to treat the parasite, always you need to treat other associated conditions also, because most of the parasites can cause severe itching. That is the main reason when the owner will choose the cat to bring to the pet clinician, because first to treat it this itching, we need to choose the symptomatic therapy. The hydroxyl hydrochloride, what we are using regularly, that chlorophenol, phenylenediamide, cetirizine are old drugs, but still they are using. But next we started with the new drug fexofenadine, human available. Recently, Drools also launched this product in veterinary sector, the fexofenadine, and clemastine also we are using from the human sector. Some other supportive medications we are using for treating, for example, these parasitic infection can cause development of secondary or bacterial infection. For that, we are using the fluticasone and steroid, micromycin ointment, antibiotic. Next one, the product contains the physic acid and vitamin E. It's a spray. Excellent spray where we are going to see the healing is faster. When the superficial dermatitis will be there, maybe association with parasitic or fungal. When the superficial is there, it's the best choice. Regular shampoo, ethyl lactate, where you are using the based on the, for example, parasitic infections are alone are there, we are not advising any in cats because of the safety precaution. But the damage caused by this parasitic infection should be addressed. For that, we are using the different combination of the medications. Association conditions, when there is a possibility of a secondary bacterium, you need to choose the antibiotics based on the experience. You can choose it. Generally, we are using in cats amoxicillin, clindamycin, and doxycycline, or antifungal, ketoconazole, anticonazole. Based on the dose, you need to go. If you are exceeding the recommended dose, you are going to see the hepatotoxic and antiviral. That's why we need to see the antiviral. Most of the cases will have the viral infection possibility will be there, or association conditions are the immunosuppression, because most of the time any chronic pruritus or itchy cat, there is a possibility of atopy suspicion. We are using the dumping the steroids over it. It leads to the suppression, and finally there is a possibility of development of exhibition of the viral infections. Can be treated along with that. Now, previously, the developed one new antibiotic has seen that the linezolid, where you can use the when you are not responding cases regularly, you can use these two combinations, the multiple resistant bacteria cases. Next, coming to the zoonotic importance of these vaccinal parasites, because I have seen personally few clients where they had the skin lesions over the body. So that I thought it's better to incorporate in this topic. What is the importance of these parasites and development of the human science? This is the flea allergic dermatitis. Generally, these fleas also they won't take the blood from the humans. Simply they will go and stay over there, but they are going to produce the dirt, the flea feces or saliva. The saliva or dirt is highly immunologically active to the humans. For this region, we are going to see allergic reaction in humans, development of erythematous patches. Next one is zoonotic importance. This case also one of my cat owner's hand. Here also we can see the development of the erythematous and the small papule-like lesions. Their cat had the noted race. This one also. I kept these two slides because they can cause lesions over the humans also. This is our responsibility to educate. Next one is there is a possibility of these ticks can cause the development of the thrombocytopenia syndrome along with the femur in humans. Finally, how we have the prevention of this parasitic infection? Only caution, we need to first educate the owners, because most of the parasitic infections they will have the similar clinical signs. They are going to exhibit here. If you know the correct diagnosis, you can identify the type of mite, you can plan the therapeutic protocol. For this information, we have to provide to the owner. This is very important. For example, I told now 4 mite infestations. One is demodicosis, comparatively less, but it requires minimum 3 to 4 months of medication. If you treat for 1 month, surely recurrence will be there. Number 1. Number 2, noted risk cat, highly itchy mite, where we are going to see recurrence will be there. Even though you treat it, again there is a possibility of recurrence will be there. Next one, otoductus mite. In this case, if you treat only mite-cidal drug, it won't recover. Always otoductic mange or ear mite should be treated with ear preparations. First, you have to clean it. You have to provide the environment which is not suitable for growth. Because if you won't explain these things to the owner, he is not going to continue the medications as per prescription given by you. Next one is fur mite. If you see the fur mite behavior, if you have thousands of mites over the body, if you use fipronil spray once, within two doses, 2 weeks period, surely you are going to see the losing of all the mites. But the logic here, surely they are going to possibly again recurrence will come. The reason behind, they can survive their eggs outside for 10 to 15 days in a home. For that reason, always there is a possibility recurrence from the same house or the same bed or the same carpets. If you educate the owner, surely there won't be a recurrence and we can prevent these further infections. Next, measures of the environment. What are the measures can be taken? If you come to the life cycle of the external parasites, always the only adult stages will be there in the host. They are taking their meal from the body. But all other stages, most, they will be out only, except for a few mites. Here we have to identify the eggs, other stages, how much time they will survive outside the body or in a house. If you know the time and duration, we have to clean the house and premises while treating the cats also. For that reason, what we are advising, based on the type of mite, we have to formulate the therapy, the prescription, followed by before completion of this entire duration of the therapy, we need to ask them to clean the house also. For that, we have the different protocols based on the type of external parasites, we change it. Method of eradication. Here always you have to choose the treatment component should be mixed with the eradication procedures. This is the topic. Finally, conclusion of this today topic. Always definitive diagnosis is the key. If you want to treat successfully external parasitic infection in cats, first you should go for the definitive diagnosis, because all the signs are looking like other diseases of the skin also. For example, I said starting miliary dermatitis. The same signs will be there in demodicosis and fly mosquito bite allergy, simultaneously nototritis also. Definitive diagnosis is very, very essential to start the therapy. Next, associated disorders. For example, we are discussing about some immunological disorders, then association conditions will be there. Especially hyperthyroidism or hypothyroidism, some adrenal involvements, some hormonal disturbances. For that, association disorders should be identified after identification of primary or parasitic infections. Next one is formulation of the same treatment protocols. What we discussed in now, this is very essential, because most of the ectoparasitic medication what we are using, they are not completely safe. We can use the word of off-label. For that reason, always we need to go for choose based on your experience, and the condition how the owner is going to use them. For example, sometimes owners will tell we are going to use like that only, but we are not going to, because we have seen many cases of toxicity, including ivermectin toxicity also, because that simple tablet itself difficulty some of the owners to give it. For that reason, always you should be cautious while formulation of therapeutic protocol. The owner consent should be there. This is the conclusion of today's webinar, and I want to acknowledge a few. First, I want to say thanks to Dr. Sivajyoti, Associate Professor, Faculty of Veterinary Parasitology, Sudhakara University, Andhra Pradesh, because she is a Associate Professor of Parasitology, and my wife too. She was the best diagnostic information what she used to provide for all the cases what we have seen in clinics. First, I have to thank her because providing the best pictures and the videos for this webinar. And next, I have to say thanks to the Association of the Veterinary Dermatology India for giving me this opportunity to present this webinar. And I have to say thanks to the knowledge partner, and today's hosting is the Drools Private Limited. Next one is I have to thanks to the Vice President of IAVD, Madam Sumati Madam, because for giving this opportunity for deliver this webinar. And I have to thanks to my students because for the past 5 years I have seen the different cases of dermatological events. All my students who helped me taking the scrapings and the pics, all my students. Thank you for everyone for involving in this webinar. And we have any doubts, we'll continue in the question and answer sessions.
Thank you so much, Dr. Reddy, for that insightful practical session. So we truly appreciate your time and expertise. Now we'll move to our interactive question and answer section.
Hello.
So if you have any doubts, you can post them in the chat box. Any
Before
doubts
that, I
regarding the
want to-
session or any question for the IAVD team, you can feel free to drop them in the chat box. We'll take them one by one.
Okay. Before that, I want to just add 3 important things.
Okay.
Hello? Can you hear?
Yeah, you're audible, doctor.
Yeah, actually, very nice presentation, very interesting presentation too. And of course, you said thanks for your wife also. That is very important because you have to go home. So it is very good. And apart from that, what I want to say is whenever there is a problem, particularly the notodirus, you can share, you can stop the sharing, doctor.
Okay, sir. 1 second, sir. Okay.
Yeah, here, just I wanted to say something. Whenever there is a notodirus infestation, most of the time it will have some immunosuppressive reasons. So it is very important for clinician to identify the immunosuppressive reasons, whether any fungal infection or viral infection. Most commonly, cats are prone for viral infection. So the viral infection and other immune suppressive diseases are there or not, that we have to find out. Then apart from that, doctor was telling about the ivermectin. In anti-parasites, nowadays all over the world they stopped using ivermectin for cats because it is very toxic for cats. It is better to avoid. Even for teaching, we can avoid that so that the young generation and future generation will go ahead with the safety drugs, because we have got a lot of isoxazole groups of drugs, either as a spot on or oral. So we can very well go for it. And then we have to identify, even though isoxazoles are coming under the ivermectin groups, we have to check whether it is suit for the particular breed or not. That is very important. Particularly, generally the isoxazoles will be suiting for everything, whereas the melbimycin and other thing, they also ivermectin groups. Sometimes they may have some reaction with certain breeds. So you have to check before going for any deworming. That is very, very important. Apart from that, the antibiotic, what he is telling about the linezolid, that is also we have to avoid, because only he was telling about the methicillin resistant antibiotic only we will be using. In those cases, what we have to do is we have to go for culture and antibiotic sensitivity. With the help of culture and antibiotic sensitivity alone, we have to check for any applicable antibiotic for those cases which is resistant to any antibiotic. So the first line of antibiotics are not going to help, then immediately you have to go for culture and antibiotic sensitivity. That is very, very important. So these are all the things I wanted to stress. So any questions we are ready to answer. Doctor also ready to answer. You can just
because and few things. Really, immunosuppression also possible.
Possible.
Next time onwards, we will try it, sir. To search for
Most of
that.
the time, immunosuppressive reasons are the important reasons to have the dominance of the sarcoptics or any mange, any autoderus, particularly in cat. So that has been recorded in so many articles. So you have to stress that.
We search for the immunological disorder also, sir.
Yeah. Let them go through one by one all the questions.
Sir.
Can you see the chat box and see what is the?
Yes, madam.
First question there is, can you tell me some common practices which owners or pet can avoid in relation to parasitic infections?
1 second.
Common practices to avoid parasitic infections.
1 second.
Okay, you can.
Generally, in mild cases, what will happen, they won't show reaction of itching, particularly in cat. So only by seeing a trichogram, we'll be seeing the broken hair. Apart from that, if you are going to take your cell phone, and see under zoom effect in the camera, the skin, you can see the pepper and salt appearance in case of furmite. So when the furmite is going to be there with the naked eye, sometime you may not be in a position to visualize. So at that time, you had to go for zooming the area with the camera. So you can see the salt and pepper appearance. Then you can take a brush and see the furmite under the microscope. So in that way, we can prevent. And in case of any notoderus or sarcoptic infestation, it is better to have hot water wash in the area where it is prevailing. So that is very, very important, because in the high temperature, they will die off. That is a freak, because they will be there for more number of months. So it has to be cleaned regularly and make the area clean by using hot water wash of the area. That is very important.
Doctor, now I'm able to answer. We will discuss one by one.
So there is a question regarding, doctor, common practices to avoid parasitic infections in our household and
common practices. What we can use it.
Yeah.
First one is we need to understand the life cycle of the parasite. That's what we need to explain to the owner. Not only treating the parasite over the body, always we have to check for their stages will be there in the households, that furniture or beds or some carpets. While treating this parasite over the body, always you have to touch these areas also to prevent further infection. For that, we have to give the information to the owner how to treat them. Just what sir is telling, we are using hot water. Always it's better using of the compare with the normal water, the normal temperature water. Better to use the hot water. It's going to give the benefit than compared with the normal water. That's first one. Second one is when you are using house premises, always you have to disinfect the house with the available disinfect solution based on the availability minimum once in 10 days. Once in 10 days when you have the problem, especially fungal spores or parasitic stages can be treated with this. Not only treating the animal, always you have to concern about the environment, the houses also, where we are going to miss most of the time. Next one.
Thank you, doctor. So next question is, from what age we can use selamectin spot on? And another one is, how to treat mite infestation in young kittens, like 1 month or 2 months of age?
Yes. Actually, that selamectin drops you are advising about 2 months only. They used to say 6 to 8 weeks of the period. But most of the time, the reason behind that, there is a possibility, if, for example, most of the company products what they are providing selamectin drop percentage solutions are body weight wash. For example, the same concentration is going to provide that intradermal application, the topical dermal application, they are going to absorb it. There is a possibility of localized reaction will be there. Sometimes when you are providing higher concentration, there is a possibility of the neurological involvement. For that, you are avoiding the 6 to 8 weeks period. If you are using the same oral medication or some other product, this is also causing the blood-brain barrier, so that there is a possibility development of nervous sense. So that better to avoid under the 8 weeks of age all the drugs for the mange. But when you are thinking about the very young cattle are suffering with this type of mites, we need to go for only two things. One is frequently we need to check for what type of mite. If it is based on the type, the treatment can be validated. For example, when you are going to see the fur mite, superficial application, for example, the product is available, fipronil spray is there. There's actually 0.25% solution. You make it a triple dilution and take over the cotton. You just apply over the body with the hand itself, with the cotton itself. You cannot directly spray over the body. Like this, we have this we can change alter the procedure. Nothing but we are going to dilute the medication. That's what we are doing. Simultaneously, we need to provide increase the immunity of the cats. And nowadays we are getting some herbal preparations also, adding the neem oil, like that. Some products are available. Those products also can use when we are treating the kittens.
So apart from that, natural products are very effective in young kitten. Then because of risk of toxicity, we are avoiding that in less than 2 weeks, 2 months old. So in those cases, we'll be going for lime sulfur also we can use. Lime sulfur and natural herbal products also you can spray, because large number of herbal products are available nowadays, very good, with a very good effect. So those things you can use.
Sir.
Thank you, Dr. Nagarajan. Thank you, Reddy. Then the next question is, can we use same treatment for all mites?
No. Actually, that's what I told while presenting. For example, we discussed 4 types of mites. When you are saying about the dermatitis, it requires that too based on the type of dermatitis. That's what superficial or deep. The treatment duration varies from 3 to 5 months. Even though we are getting toxicity, but for that what we are doing, not daily, we are going to do once in 2 days or once in 3 days oral administration of the drug. That's one. Second one is notodress mite. Here, if you give the topical also, it won't respond. For that cases, what we are doing, we are giving the parental followed by external sprays. Third one is otodectin. Here we are going to see most of the mites will be there within the ear canal. Here we have some products, pet armor like, where they are adding the pyrethrin solutions. That's what I discussed in the webinar also. Generally, we are not advising these pyrethrin preparations, even though they prepare the product very low concentrations, but it's localized only. And only here you can use it. Next one is the presence of lice, Linux also is there. For that, you are using the safest is the spot-on preparation than compared with other preparation, because they are only superficial only. When the skin enters grasp the contents, it's easy for the recovery. Like that, based on the type of mite, the treatment will vary. That to intensity.
Thank you, doctor. So next question from Dr. Piyush, we have a question regarding, it's very difficult to differentiate the case without skin scraping. So many signs overlap and sometimes there will be mixed infections. So how to approach such cases in the initial days when owner expect us to diagnose just by looking it?
Yeah, very good. This is the most common problem what we are facing in clinics. For that reason, for example, ticks we can easily identify, pick it. Lice, if we have the magnifying lines, we can see lice infestation is over. Fleas is difficulty to see the live mite over the body. For that, you take the comb and see for the flea dart. Put a white paper, little bit touch with water. We are going to see the flea dart. Next one is mite infestation. You come to the mite, any cat with severe otitis or presence of vaccine material, we have to suspect for otodectin. Next one is, if you see able to see the sandpaper like appearance or presence of some sand like deposits over the dorsum area. So just imagine, take some sand, put over the cat body. You just see, if you are able to see this type of color, we have to suspect for this one. Suspicion only. further confirmation, we need to go for that. Simultaneously, when you are going to see the ear margin dermatitis, you can suspect notodress. These keys will help. For confirmation, only scrapings.
Thank you, doctor. So next question, could
See,
you please
apart from
elaborate as
one minute,
Ah,
apart from that, that flea, sometimes not necessarily there should be flea on the body. So it may be having a flea allergic dermatitis. Say it may be there, but it may not be when you are examining it. So at that time, so the symptoms like flea dirt, sometime it may not be there. So only the hypersensitivity reaction you can expect to have. So in those cases also, you can go for treating for the flea medicine. So we are having spot-ons and other thing. So that will help a lot to. So by seeing the response for the treatment, you can very well go for identifying what allergy it is. So any allergic dermatitis treatment, first and foremost thing is you have to avoid first you have to go for flea treatment. Then only you have to go for food and environmental allergy. That is the thing. Okay.
thank you, doctor. So, doctor, next one, could you please elaborate acetate tap test?
Yeah. Here we are going to use this acetate tape test for two reasons. For example, have you seen any dry lesions over the body or any suspicion of eczematous lesions or crusty lesions in the body? You take the tape, like what you are using for the papers. You touch over the body. That sticky nature should touch the animal's skin surface. Touch this. Take this one directly, keep over the slide, and examine under microscope. We are going to see ticks followed by fleas and linaxeris and demodecasis also. This is the first one what we can do. Touch the body is nothing but what you are doing as a part of dermatological examination. We are going to see with magnifying lens direct body. Here we are going to use more magnification. Nothing but directly we are visualizing the contents of the crush in the under microscope. This is first one. Same procedure. If you add keep a slide, put a drop of methylene blue, stick over it. The same tape we are going to use it between the slide and the tape. If with the drop of methylene blue, we are going to see some fungal hyphae or spores because it's going to give the contrast to visualize it. For that, you are using the acetate tape test.
Thank you, doctor. So the next question is, some safe antibiotic and NSAIDs for cats. So basic. So, then we have best drug for treatment of air mites, and is there any resistance to salamectin in case?
Resistance not documented. The reason behind that, what you are using only Spartans only. When you are using the Spartans, it's difficulty to get the resistance. The only thing is the concentration difference will be there because we have two products, 6% and 12%. Concentration is not we are using in dogs. Sometimes there is a possibility of the crystals using also. Till now, as per my knowledge, there is no resistance for this. And to report resistance for silamectin also difficulty because we are not, it's not a systematic drug what we are using. Only is going to apply to the skin only. So you cannot say resistance. The safe one what we are going to say for ear mite infestation, first we need to treat the otitis because we have to avoid the favorable environment for growth. That's the basic step what we have to do. Regular cleaning can provide the beneficial for that. We have one product what I said directly we can keep these drops into the ear house. In foreign countries we have mite-sidal products directly you can keep into the ears. But here I don't know whether they're available or not. I think they're not available in India. Directly what we can keep in the ear, that mite-sidal products. But how we can manage? We can manage with avoid the favorable environment, and simultaneously we can provide the spartans or spray around the ear. Or
Thank you.
systemic you can use it.
Thank you, doctor. So there is another question: how to differentiate between sarcoptes and notoductus? If not able to differentiate microscopically, like any specific lesions or specific something.
Simple to say, generally getting of the sarcoptic mite in cats is very, very limited. Very, very limited. If generally, if you want to say those group, those family mites are there, we can say nototrus directly, 99%. But 1% cases will get the sarcoptes too. The reason behind that, generally the nature is very highly host specific. Simultaneously, when you have the combination of dog and cat, there is a possibility of development of this sarcopsis. To differentiate, how to differentiate it microscopically if we have those two mice together? Only one caution, both are looking like round only, all the limbs within the limits only. The only thing, sarcopsis, we are going to see triangle striations of the dorsal region, like crown, how the crown will be there. Like this, we are going to see different triangle striations, like elevation material over the sarcoptic mites than compared with notodress. Notodress, we are going to see round like lesions all over the body, looking like your fingerprints. How we are going to visible? How this will be if you put the fingerprint like that, the dorsum will be visible. Only based on the dorsum we can differentiate. Blindly to say, most of the time notodress will be there in cats. In dogs, sarcoptis will be there.
Thank you, doctor. So another one is you mentioned about ivermectin drug, the parasite developed resistance. So some alternative drugs to use in clinical practices.
Once again, ivermectin.
About ivermectin resistance development you are discussing right now.
No,
So
no ivermectin resistance. Is not a resistance to the ivermectin. The if you use the ivermectin, there is a possibility of development of adverse reactions. For that, we need to go for other drugs. That's what we have chosen is milbemycin is the oral one. Or we can go for ivermectin also is the same group of drug. But the only thing you have to give the subcutaneous administration. Otherwise, better to avoid these kinds of complications. Directly, you can go for the external applications instead of ivermectin. Some neurological signs will come. This is not the resistance, it's only adverse effect or side effects.
so what about doramectin, doctor? Doramectin.
In the injectables
When
material are available, we can
when
give
isoxazole groups have come, they are all advanced and safe drug. That's why they insist to go for it. See, in those days, in the olden days, we used to use copper sulfate. We are using now, so it is not like that. But the effectiveness and safetiness is more in certain drugs like lime sulfur. So we are still using it, like Kylin. So it is very, very important to identify the percentage of toxicity which is creating by the animal to the maximum number of animals. So here the ivermectin create a lot of toxicity in cats, particularly. That's why even if you are going to publish in international journal, they won't accept if you are going to give ivermectin. See, we have done a lot of studies in that. So even then, they are not accepting because we are using ivermectin. So ivermectin is effective, but many ways it is toxic. So it is better when there is a better drug is available. Why you are going for ivermectin? That is the thing. So the safest drug is very, very important for practice. That is because if you are going to use toxic drug, and you will be having a lot of problem with the owners. That is the problem. Okay.
Thank you, doctor, for clarifying that. So there is one more question regarding, can we bath after using this lime dip? Like, do we need to
It needs
bath
to be
after?
dried. It needs to be dried.
Needs to be.
Actually, it is only disadvantage with the lime self is that the smell, the bad smell, rotten egg smell will be there, and also it will be having a discoloration for some time. So that is the problem. People are not using it. So otherwise, we can use it, and which can be used safely than many other drugs because it will be having action both on parasite and also in fungal infection. So that is the best drug for cats.
Thank you, doctor.
Thank you, doctor. Yeah, tell me.
Can lime sulfur be prepared locally? Some last question.
It is available in the market. Variety of companies are there. Why you are unnecessarily trying to go for it? You can very well have lime sulfur in the market. A lot of companies with a cheaper rate, and it is having a good efficacy you are getting. So you can very well use that. Okay.
So thank you, Dr. Nagaraj and Dr. Reddy, for clearing all these doubts. And so that brings us to the end of our question and answer section. Thank you all for the wonderful questions also. So to conclude, we invite Dr. Neelesh to deliver the vote of thanks. I welcome Dr. Neelesh to share his words.
Thank you, ma'am.
Welcome.
You
Dr.
are
Neil,
nice. You are a nice anchor, and you handle questions very diligently,
Yes.
along with Nagarajan sir, or
Dr. Neelesh is our
dynamic personality.
Dr. Nilesh is our administrative committee member. He is a very important person for us. What you are seeing in the video, YouTube video, all uploaded by him. He is the one who is currently acting on all our media. He is a very important officer, media officer in our administrative committee. Thank you. You please.
Thank you, sir. Thank you,
Yeah.
sir. Now I will be thanking our main speaker, Reddy sir, dynamic personal.
Good
He is
afternoon.
very diligent. He presented very well. And if I can see in the comments, many people who are parasitologists, they are giving very nice compliments for him, because the quality of slides he used for showing to us. They are wonderful, fantabulous, and I'm thankful to you, sir, Reddy sir.
Thank
You
you.
have always been a dedicated person. I have met you in many conferences, and completely dedicated to the subject and to the veterinary profession. Thank you. I'm thankful to our president, sir, Nagarajan sir, who has been always ready for dermatology. Dermatology is in his blood. I think he wakes up with dermatology and he sleeps with dermatology. And then I'm thankful to Drools, who has been associating with all of us for presenting such a good and informative webinars. I'm also thankful to all admin members. Venkateshwaran sir, I think he is here. He is being giving reply to all in the chat section, and all other committee members are also contributing. So I'm thankful to all of you. Thanks a lot to all the participants who have joined there, and it was a wonderful webinar, and we will catch up in the next webinar. Thank you. Thanks a lot. Jai Hind, Jai Bharat.
Thank you.
Thank you, Dr. Nilesh, for the warm vote of thanks. So with that, we'll now move forward to the closing of today's session. So before that, the gentle reminder to please fill the forms in the chat box to receive your certificate.
Okay.
So, once again, thank you all for joining this session. And my heartfelt thank for our dear speaker, Dr. Reddy. And thank you, Dr. Nagarajan, for the vote of thanks. And thank you, Dr. Nilesh, for the vote of thanks. And also thank you all for participating in this webinar. And look forward to seeing you at your future sessions also. That's all. Thank you.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
Or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
rules.
Drools.
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 Drools. Feed real.
Fitly.